Hey there, welcome back to our YouTube channel. We're happy to have you here today, but first, I'm Rachel.
And I'm Jessica. We are the Certified Occupational Therapy Assistants at Harkla, and today we are going to talk specifically about oral motor dysfunction in children.
Now, before we get started and jump in, before you click out of this video, just know this is not our area of expertise per se. We deal with oral motor dysfunction, but we are not going to give you specific strategies in order to improve oral motor challenges in this regard, because we want to bring it to your awareness to let you know, hey, if you are noticing these things either in yourself or your child, you need to go get an evaluation. And we're going to talk about who you're going to go see, what you're going to do, and how you're going to do it. But just a quick disclaimer, this is not our, overall area of expertise. It is just something that we feel called to share. It's just really beneficial information that we feel needs to be out there in the world more.
Yeah, oral motor dysfunction is going to affect every part of a child's life. It's going to affect their ability to speak and articulate what they want and what they need. It's going to significantly impact their ability to eat a variety of foods and drink enough water throughout the day. It might even affect their ability to breathe and sleep well at night. So it's definitely something that we want to just bring to the attention of everyone watching this video. And then, like Rachel said, we'll kind of give you the next steps that you can take if you're noticing this in your child.
I just want to share a quick quote that I have heard over and over again. It's what happens at the lips affects the hips. And it's just a funny little rhyme to remind you that if we're struggling with things orally, it's going to impact our posture, our stability, our core, just functioning on a daily basis. It's going to impact our ability to get through just everyday activities. And then one quick functional example that I want to share for a child who maybe is struggling with speech, and we put them in a swing, give them that vestibular input, that trunk input. We notice that their speech and their ability to expressively communicate improves. So there's just a prime example of that quote, what happens at the lips affects the hips. So just remember that as we're going throughout today's video, but let's jump in.
We're going to list off some of the signs or symptoms that can be associated with oral or oral motor or oral facial dysfunction. And if you're noticing any of these in your child, in the clients that you work with, or even yourself, keep listening because, like we've already said, we'll give you some steps to do at the very end. The first one is teeth grinding. Now, this can be teeth grinding during the day, during stressful activities, or specifically at night. If you're noticing that your child grinds their teeth while they're asleep, this can actually be a sign of some oral dysfunction going on.
It's actually, if you try it right now, if you grind your teeth and breathe, and then grind your teeth, and then don't grind your teeth and breathe through your nose, notice what it does to your airway. If you grind your teeth, it opens your airway, and if you're not grinding your teeth, you might be able to feel your airway is a little bit more closed off and harder to breathe. So try that and see how it feels. The next sign or symptom that we're going to want you to be aware of is mouth breathing and snoring at night. So if your child is a big snorer, they sound like a bear when they're sleeping, or if they are sleeping with their mouth open, we want to make sure that the tongue is suctioned to the roof of the mouth when we're sleeping. We want that to be just the resting posture. If we're not seeing those things, it can be a sign of some oral motor, oral facial dysfunction, and we want to rule those out.
Going along with that, our resting oral position just during the day when we're not talking or doing anything is also the same as when we're sleeping, with our mouth closed, our teeth closed, and the tongue is suctioned to the roof of the mouth. If that's not happening and your child has an open mouth posture during the day and they're not able to breathe through their nose, then that can be a sign as well. I'm not talking about when your child has a cold and they have a stuffy nose, because that's something that can happen. I'm talking about just in everyday activities, your child's not sick or doesn't have an illness. This is just their natural posture of that open mouth posture. We want to be aware of that.
Another thing that we can see with orofacial, orofunctional challenges, behavioral problems. I know you're like, how are those even connected? Well, let me break it down. If your child is not sleeping or if they're not getting good quality sleep at night, that translates to behavioral challenges during the day. So, when we're looking at this whole list, it's important to look at the whole child and really just, put your goggles on, your sensory goggles, and see what is the real issue here. What is the underlying challenge? We want to find that root cause, and let's make sure that we're not, just chalking off behavioral issues as they're just a behavioral kiddo. It could be the lack of sleep. It could be, similarly some ADHD challenges, some sensory processing challenges as well. It's all connected here, and we want you to be looking at the whole picture.
Now, how do you know if your child is struggling with sleep? Well, like we've already mentioned, if they are grinding their teeth while they sleep, or if they are snoring or have that open mouth posture during sleep, they're actually not getting the good restful sleep because they're not in those more natural positions for restful sleep. And then that in turn causes them to be very cranky throughout the day. They're fatigued, they have shorter attention spans, they might have more meltdowns because they're tired and then because they're not getting sleep, because their airway is not fully open and they're not able to get that good restful sleep. It's all connected.
It's all connected. Going along with that, we want to look at their posture. So we'll talk about tongue ties a little bit. If your child has a tongue tie, remember it's normal to just have that frenum there, but if it's in the wrong position, if it's too tight, it can actually cause posterior tightness. We can see slumped posture. We can see decreased flexibility. I know with me personally, I have a very tight frenum, and it's something that I want to look into, but I have a very tight posterior chain. I've never been able to touch my toes, and I notice that I have kind of a slumped posture when I'm not thinking about it. So posture is something to look into, and neck pain as well for those orofacial challenges.
Another thing that we notice oftentimes with kiddos with sensory processing challenges or SPD is that they also have oral dysfunction. So because their sensory system is not processing the sensory world the way that it can, like not to the best of its ability, and it causes challenges with sensory processing, goes hand in hand with oral challenges so much of the time. So if your child has sensory processing disorder or just sensory processing challenges in general, we want to take a look at their oral functioning.
Another kind of random symptom or challenge we can see associated with this oral dysfunction, digestive issues, especially in infants, but reflux, colic, that sort of thing we can connect to oral dysfunction, but in older children and adults, we can see digestive issues as well. And again, trying to rule out what the underlying actual root cause is, but it's something to just have in the back of your mind.
Another one is speech, language, and articulation challenges. So it takes a lot of coordination for our cheeks, our lips, our teeth, and our tongue to produce the sounds that we want to produce when we're talking. And if a child cannot coordinate all of those different pieces together for some reason, then they are going to have speech and language challenges. They're going to struggle to articulate sounds and words. So we always want to take a deep dive if we notice those challenges and ask why. Likely there's an oral motor dysfunction happening.
Another symptom is overcrowded teeth. Again, going back to our tongue resting posture, it should be suctioned to the roof of the mouth. That position widens the mouth, so that way the teeth have space between them, especially the baby teeth. When the tongue is not in a proper position at a resting posture, it's not going to widen the jaw, it's not going to properly space out the teeth. And so when we have overcrowding or there isn't like a little space between each of the teeth, that could be related to oral dysfunction.
Another thing we want to look at is if the child is sucking their thumb or using a pacifier beyond the age of 3 years old. Going right along with what Rachel was saying about the tongue helping to widen the palate. If the child is thumb sucking or sucking on a pacifier for too long, it can actually cause their palate to be too high and narrow, which can cause overcrowding of the teeth, which then leads to other problems later on.
Yep. So a lot of these things are ways that the body and the mouth has compensated in order to breathe, because that's the goal. We need to protect our airway. So things like bad breath or, food on the tongue or like a white tongue, just challenges with moving the tongue in a proper position to clean it, to get rid of bacteria. That is definitely a factor as well and something to rule out. But just keep in mind, any way that your child or you are compensating for oral dysfunction, the goal is to breathe and to protect our airways, so we want to make sure that we're catching those compensatory strategies.
We just listed off a whole bunch of signs and symptoms that you might notice if your child has some oral dysfunction. So what do you do next? Where do you go? Who do you seek out for help? What is the next step?
So the goal is to find someone who is well-versed in orofacial myofunctional therapy. You could just type in a Google search in your area and see what comes up. You could find a speech language pathologist, an ENT, a pediatric dentist, someone who has that understanding and that knowledge of the orofacial myofunctional therapy. That is step one.
We do have a couple of podcast episodes, some interviews with some professionals. We will link those in the description below because that is a great place to maybe start and listen to what they have to say so you can better understand what the role of that professional is.
Craniosacral therapy is another tool that could be beneficial. Maybe doing a sleep study could be beneficial as well. But I would start with seeking out someone who is trained in that orofacial myofunctional therapy and then go on to a pediatric dentist or craniosacral therapy or a sleep study. So find the underlying challenge, find someone to look at the tongue tie, lip ties, buccal ties, make sure that you're ruling out all of those underlying concerns.
Oftentimes we'll hear from parents saying that they seek out a professional for these challenges and the professional tells them, no, there's nothing wrong, there's nothing we can do, they'll grow out of it. But honestly, if you, the parent, are thinking that there's something going on with your child, you are their best advocate. Go with your gut and don't stop advocating for your child. Seek out a different professional somewhere else. Keep searching, keep pushing until you find someone who is able to help you. Because if you feel like your child is struggling in this area, you know best. You're with them the most. So don't stop just because one person says, no, it's totally fine. If you feel like it's not, don't stop.
And if you do find out these concerns are going on and they're valid, it's going to take consistent therapy in order to really make a difference. So just make sure that you are mentally, physically, emotionally capable to participate in some serious home exercise programs. And the work really begins once you've begun therapy.
Yep. Now, like we've already mentioned, we have a lot of free resources for you. We will link all of our podcast episodes and other YouTube videos on oral motor down below in the description, as well as a couple of different articles and links so that you can learn more about this topic.
Make sure you subscribe to our YouTube channel. We drop a new video every Tuesday. Definitely like and comment on this video if you had an aha moment. If you have questions, we're happy to help. And we will plan on chatting with you next week. I kept it short. Nice. Keep it simple, stupid. Right? Is that what they say?